Good morning and welcome to the keynote address for the virtual parent conference. My name is Daniel Titoni and I'm the parent commissioner at the EMSB, an active member of the Parents Committee. We are so proud today to bring you this great conference. This is our fourth iteration of the parent conference and we have been improving on it every year. This conference would not be possible without the incredible support from the EMSB Student Services and Educational Services, as well as the consultants and educators from Shabbat Lifeline, Concordia University Project Someone, Grossophobie.ca, E2 Adventures, Champions of Life, the Psychiatry Program at the Jewish General Program, and our sponsors EPCA Quebec, Gaia Ninja, Oxford Learning, and Learn Quebec. I now leave you with our moderators for our keynote, Michael Cohen and Carolyn Phaneuf.
Thank you very much, Daniel. My name is Mike Cohen, and I'm the Communications Specialist for the EMSB. And joining me is my co-host. Go ahead and introduce yourself, Caroline. Caroline's on mute.
I'm muted. There we go. Taking myself off mute. We were just joking about that actually before going on. I'm Caroline Phaneuf. I'm past chair of the EMSB Parents Committee and the mom of 2 EMSB students. I'm an international communications and marketing consultant in private practice. And actually my main client at the moment is the federal COVID-19 Immunity Task Force. So I know some things about the disease we're going to be talking about and causing this awful pandemic. So clearly there's no better headline topic than COVID, as it's taken over all our lives for more than a year now. Many parents are very nervous about sending their kids to school, and others are nervous about having them home all day. So on behalf of the current EMSB Parents Committee, Mike and I are pleased to bring you a 2-part seminar entitled Resilience Through the COVID Pandemic. We'll start with a special keynote speaker, and then we will host a panel discussion. And I'm pleased to say that all 3 speakers are EMSB parents.
Thank you, Caroline. We're very privileged. I really want to thank the 3 people who stepped up today. They are EMSB parents. They are extremely busy. The keynote I'll introduce momentarily. We'll introduce more formally Aaron Derfel, who really needs no introduction. He's probably one of the top health reporters in all of Canada. And we're fortunate to have him in Montreal at the Gazette and at the EMSB as a parent of 2 students. And Dr. Debbie Schwartz, who's been one of the more prominent spokespersons among the physicians on COVID-19, also an EMSB parent. So really thrilled and excited to have both of them with us today. We'll begin with our keynote speaker. Dr. Earl Rubin is the Division Director of Infectious Diseases at the Montreal Children's Hospital. Dr. Rubin completed training and became certified in 3 disciplines at McGill: Pediatrics, Infectious Diseases, and Microbiology, and has spent his entire academic career at the Children's. He's widely recognized, highly valued, and well-respected clinician and educator. And a true fact, in 1980, in the same class as yours truly, from Wager High School in Côte St. Luc, we both graduated together. One became a doctor and one became a communications specialist. You know who's who. Dr. Rubin is a father of 3. His youngest is presently a student at Royal West Academy. And he's also had COVID-19 this past winter, so he's got a lot to share. So thank you very much for being with us, Dr. Rubin, and the floor is yours.
Thanks, Mike. Hi, everybody. I'm just going to share my screen. And hopefully you can see the slides. Carolyn, Mike, you can see the slides? Yep.
Yes, I can.
Perfect.
Yeah.
All right. So we're going to do a whirlwind tour through some things about COVID, and then in the question and answer, we'll be able to address things that I don't address. I just have to figure out how to advance my slide. There we go. So I think we've all been living through this. For those of you old enough to remember Friends, when it hasn't been your day, your week, your month, or even your year, certainly 2020, we are happy to put behind us. So to quickly go over how do you decrease COVID-19 spread? But before I actually start, the one thing that I've been saying to anybody when they ask me questions about COVID, predominantly at work, because I'm one of the 2 infection control leads, is what I'm telling you today is probably different than I told you last week, and almost certainly will be different than I would tell you next week. We are constantly learning. We are constantly changing based on what we are learning. And unfortunately, that leads to a lot of skepticism in terms of what we say to people because we keep changing our tunes. The same applies for the government, for the ministry and for public health. There's a lot of frustration out in the community because there are different messages being sent constantly. And it's not because they're trying to confuse us or to look stupid. It is just a fact of the matter that we do not know enough to be able to say anything with certainty. But the things that we can say with certainty is that to decrease the spread, physical distancing, masking, and good hand hygiene are the cornerstone of what we need to prevent transmission. And of course, to stay at home if you're sick and to avoid contact if you have any symptoms. So as Lucy is saying here, although COVID-19 spreads mostly via the mouth and nose, the greatest risks come from quote unquote assholes. And that is because people are not listening to public health directives. There is still social gatherings. People are coming, gathering and thinking, I'm immune, I won't get this. If I get this, it's not so serious. I'm young, I'm healthy. And this picture is just showing that you never know, symptomatic or asymptomatic, what they're going to bring to the party. So this is a study called Connect that just shows you the percentage of people who kind of entertain visitors and are listening to the directives. And you can see on the y-axis is the percentage of people who have visitors. Pre-COVID, there were about 70% of people who would kind of gather. When the restrictions first came around in October 2020, you can see that kind of went down by half. When there was the curfew in January, it halved even further. But now you're starting to see good evidence of what we call COVID fatigue. With the curfew in February, more people were gathering during school break. You can see it goes up higher, even though there was all the directives, please do not gather. And it came down a little bit with the curfew in March, but still not down to the level it was at the beginning. So this is a good slide that shows you what's happening with COVID fatigue. But what everybody is talking about and worried about are the waves. We heard about the first wave and people weren't sure if there will be a second, if there'll be a third. And the question we're getting is, will there be a fourth and a fifth? So when we look at the number of confirmed cases per day in Quebec, this goes back to March 2020 up until this past week. So here you see the waves. The y-axis is the number of new cases that have been confirmed. It looks like in the first wave, it was not very impressive, but that was really a function of the fact that tests were not readily available. So that the lower numbers of new cases per day is based on the testing. Now testing is readily available. You can see the high spike of the second wave, kind of peaking in December and January that kind of came down. And now, unfortunately, we are just at the beginning, I believe, of the third wave. There is this concept, you know what? Wave, no wave, I can wave to you if you like. That's what this little girl's doing. Or she's saying, please stay away. Is COVID-19 serious in children? And a lot of people say, it's really nothing. True, to a certain degree. In Canada, children account for about 17% of all cases. I'll give you more local data shortly. Children account for only 1.6% of all the hospitalizations. And of all the admissions to an ICU, it's only 1.3%. In Canada, to date, there have been 6 deaths in children under the age of 18. Acute COVID seems to cause little serious illness. Most of the admissions that we have had here, and the same goes for Saint-Justin, are kids who are admitted for another reason and who are found to be COVID positive and not necessarily admitted for COVID itself. However, In the second wave, and we fear with the third wave, we are getting about 6 to 10 admissions per month of this multi-system inflammatory syndrome in children. And this occurs anywhere from 2 to about 12 weeks after COVID. Most of these kids, parents, the children had no idea that they had COVID, but 1-2 months later, they are very ill, often requiring intensive care admission for support for their blood pressure, etc. And it is really quite a scary thing. It is infrequent, thankfully, but it is still a scary thing. When we look at the hospitalizations and admissions to intensive care, in the first wave, it was predominantly the elderly, defined as those over 80 years old, either coming from long-term care or from home. That was really what we were seeing. In the second wave, however, it's mostly 50 to 69-year-olds who are being admitted. 30-year-olds, 40-year-olds are not as unusual as they were before, and some are going to the ICU, getting intubated, and even needing something called ECMO. On this graph, you can see that they are at the peak, that green line, and the bottom line at the bottom are kids of school age. But there has been this dilemma, this question, should schools open? If schools open, should they stay open? Should they be online? Should they be hybrid? And this keeps on going. And you know, here SpongeBob is saying that's our secret. There really is no plan. That is what the appearance is coming from the ministry, from Legault, from public health, with changing their tune as we go along. But that's really because they change their tune based on more knowledge. I am not a psychologist nor a psychiatrist, and as an infectious disease person, specialist, I'm going to focus more on that. But certainly there are better people out there who can talk about the psychosocial impact of online learning. So if we get down to numbers, I just finished this talk, so the numbers only go to the middle of this past week, but they reflect what's really been going on. If we look at school numbers, since the beginning of the pandemic, there have been over almost 41,000 children who have proven positive for COVID in the last year. Half in 2020, and what the problem is the other half is in 2021, and we are only into month 4 of 2021. So that clearly is reflecting what's happened in the second wave and what's happening in the third wave. The number of active cases as of April 13th, there were 3,500 kids who were positive, and in brackets, the plus number are the change from the reporting the day before. When we look at the number of classes across the province that are closed, there's over 9,000 classes that are closed and 15 new in one day. Public health will opt to close a class when there is a single case within the class. If we look at new cases and break it down by age, 25% of all the new cases in Quebec as of this middle of this past week, 25% were in school age kids. But what's scary is that over 62% of the positive cases are in the young adults. And these are the parents of these kids. These are the teachers. And this is really very different than what we saw in the first wave, where the percentage would have been broken down and heavily weighted in the 80 to 89 or even the 70 to 79. Now you see in the 80 to 89, it's only 1.5% of all the positive cases. And that's a function of they were either immune because they got it, unfortunately they passed away, but much more important is vaccination, and that there is a good uptake in that age range. When you look at the school-age kids who are positive, you can see that the percentage increases with age, so lower, but still 29% in the preschool and up to almost 40% in the high school kids. But despite these high numbers, thankfully, it is not translating to hospitalization or severe illness. Here overall are the numbers as of April 13th, that cumulatively since January 5th, there have been 16,000 students and 3,000 professional staff, whether they be teachers or other professional staff within the school. But we really are not seeing these numbers translate to hospital admission. As you break it down, you can go back to the beginning of the first wave. There's been 40,000 in total, and so on and so forth. So what is an outbreak? And there's a lot of confusion. The definition of an outbreak is when there are 2 or more cases. So a single case in a class is not an outbreak. However, they will still close down that classroom because they don't know if there is an outbreak, and they will advocate for kids to go get tested to know if there are asymptomatic kids in that class or not. When we look at the outbreak, each outbreak, the size of the outbreaks range from 2 cases, which is your minimum, to a maximum of 67 cases. This is within schools. And the average is about 4 cases. So outbreak people hear and are worried that the whole class, it's still low numbers. And this is just a breakdown showing you again, going from January to present time, the number of outbreaks that are happening. The colored at the top of the histogram are just showing you the size of the outbreaks. So people are going to say, wow, look at those numbers. There's 10,000 kids who are infected. There's 9,000 classes that are closed. There are a huge number of outbreaks, but it really is a fine balancing act. Again, like I said, I'm not a psychologist or a psychiatrist, but there are definitely higher suicide rates amongst adolescents. In fact, at any point in time in the last couple of weeks in the emergency room at the Children's, anywhere from 25 to 50% of the kids who are there, adolescents who are there, are for mental health reasons, if not suicide attempt. There's increase in domestic violence. There's a question of whether the education, as hard as the teachers and the schools are trying to optimize teaching online, there certainly is, it's suboptimal. And then you throw in things that make people crazy. There was that news that Quebec schools, they were distributing potentially toxic masks. But thankfully, the EMSB never distributed those masks. And now what for sure my day-to-day is the concern about the variants. So we term them variants of concern. Here, this is 3 major variants of coronavirus, but VOC is variants of concern if you ever see that abbreviated. At the present time, thankfully, of the variants, the one that is predominating in Canada is the UK variant, or the B117. But we do have the South African variant and the Brazilian variant. There is also a Nigerian variant that's in Canada, and there is a new variant in New York that we are concerned will come here as well. And variants are increasing. When you look in Montreal versus other areas in Quebec, as of April 10th, about 60% of all positive COVID was a variant, but closer to 90% in other regions. And that's really what is driving the increased numbers in the Outaouais-Gatineau regions. The bottom graph is the expectation of the variants as they're increasing. You can see from the expectation, which is the orange line, to those blue dots, that we are following what people have modeled. And you can see that it's going to be 100% of the variants in 100% of the cases will be a variant in the next couple of weeks. And why is that an issue? Is the infectivity that these variants cause. It is initially hypothesized out of Britain that it was more infectious, and that certainly has proven out around the world. There's something called R naught, or the R number. It's kind of that old Fabergé or Herbal Essence commercial. You know, I told one friend who told two friends who told four friends, and so on and so forth. The R number is the number of people a singly infected person will infect. We want that number to be less than 1. The outbreak will continue if the number is over 1. And you can see that we were over 1 at the beginning of the second wave, and we are at the highest point that we've ever been now with this third wave. And that is really a function of the variants, which are more infectious. The other concern is that these variants, are they going to be covered by the vaccine? Are they more virulent and causing more severe disease? And that, again, we are learning with time. So when we look at virulence, there is a feeling that they are more virulent, and that people are saying, based on the admissions and those going to ICU, are younger than they were before. But that might just be a function of the younger are getting infected because they're not protected by the vaccine. So as of April 15, 3 days ago, the total number of administered doses in Quebec is over 2 million, which is 25% of the population. At the present time, vaccination is open to individuals 60 and over. And if you are willing to take the AstraZeneca, 55 and older. Starting last week, individuals younger than 60 with chronic illness who are currently hospitalized or followed by a clinic are also eligible. But now we're getting into the vaccine hesitancy, and people are worried, and that I really do believe is from the media of what we're seeing with the concerns surrounding AstraZeneca vaccine and now the Janssen or the J&J vaccine. As of March 31st, almost 80% of people were open to getting the vaccine, and that's in this pie graph in the dark green. But still about 15% said an absolute no. And then about 10% were still uncertain. So where are COVID vaccines for kids, and is it coming to Canada? There is one study that has been released by Pfizer with 2,200 kids 12 to 15 years old. Right now, Pfizer is licensed for young adults starting at age 16, and all the other vaccines are at 18 and over. So Pfizer is the first out of the gate with 2,200 kids evaluated between the age of 12 to 15. Half got the vaccine, half got placebo. In the placebo group, there were 18 cases, and in the vaccine group, after a single dose, there were 0 cases. And that translated to 100% efficacy. The numbers are very low. You need much higher numbers, but the expectation is that it will be similar to what we've seen in the adults, with about a 90 to 95% efficacy. There are studies underway for Pfizer and for Moderna for younger kids. They start at the higher quote unquote age and then go down. So Pfizer has a study underway for 5 to 11-year-olds, and once that's complete, then 2 to 5-year-olds, and eventually 6 months to 2 years. Moderna has similar studies, and with what's going on with AstraZeneca, any studies on a lower age group are now on hold. And there is all this concern about, people are saying, there's Pfizer and Moderna, which seems like full steam ahead. AstraZeneca, there is this concern back and forth. Is it safe? Should I do it? Shouldn't I do it? So what is the noise around AstraZeneca is a blood clot that's associated with a low platelet count. The thing that is of concern is that it's a very unusual blood clot. It's a blood clot in the brain called the cerebrovenous sinus thrombosis. I've seen a number of these cases not related to AstraZeneca, but it is a complication of head and neck infections, but I've never seen it outside of anybody who had a head and neck infection. So with this cerebrovenous sinus thrombosis, it's mostly in women younger than 60. In Germany, they found that there is an association with an antibody that is made by the body against something called platelet factor 4. And so now there is a scientific hypothesis. In Germany, it's about 1 in 153,000 doses. So it really is infrequent. But the clots or the thromboses are not only in the brain. There were also a number of cases of abdominal thromboses, which were unusual. And this is on 34 million doses given. There are 169 in the brain and 53 in the abdomen. In another study that looked a little bit more closely to what this was, out of 79 cases, the majority were women, but it still did happen in men. The majority were in younger women. Oops, I'm just moving something around. All less than 60, but 11 were in people under the age of 50 and 3 under the age of 30. So there is this concern, and it has a significant mortality associated with it. So you can understand why people are worried. But when we look at numbers like 1 in 153,000, you then have to look at what is the rate of hospitalization, intensive care, and death from getting COVID. And so certainly right now in Ontario, with the numbers that they are seeing, over 4,000 cases per day, 2,000 people in the ICU that are reaching their capacity, there is the risk-benefit balance of saying in places like that, it makes more sense to rule out the AstraZeneca to protect people and take that chance of 1 in 153,000. If you look at the Maritimes, where they've had a much stricter lockdown and there are low numbers, it probably doesn't make sense to rule it out. And the National Advisory Committee on Immunization Practice that advises Health Canada is torn. They need to make a policy for the country and not just for a certain area. Then came the J&J or Janssen vaccine, and now there's pause there on this. In the US, there were a low number of cases that led to the pause. It was all in women, 18 to 48. It generally happened within 2 weeks and no events after 3 weeks, and the average was on day 9. But still, there was enough concern. And the Johnson & Johnson or the J&J vaccine, like AstraZeneca, is what we call an adenovirus vector. It's different. It's a different technology than the messenger RNA vaccine from Moderna and Pfizer. So basically, all vaccines are not created equal. The Sputnik or the vaccine out of Russia, we get very little data. It is also an adenoviral vector vaccine, and we don't really know exactly what's happening there. Then people ask, okay, I got my vaccine. What's the chance that it's going to protect me? So this is from the United States, where they've rolled out a full vaccination series, meaning 2 doses. And a breakthrough infection ranged anywhere from 1 in 4,000 vaccinated people to 1 in close to 10,000 who will get infected. of those who get infected, it is a minority who will be symptomatic, and an even smaller minority who will be hospitalized or die. And so all of this is consistent with the pre-marketing of the 90 to 95% effectiveness. And to give everybody a ray of hope, there is a ray of hope, there is a light at the end of the tunnel. If we look to Israel, which has done an unbelievable job with rolling out the vaccine, you can see on this graph, vaccine campaign starts, and it's not an immediate thing. On the left side are the daily number of newly confirmed cases that were peaked in the country of about 8,500 per day, is now less than 100 per day. And that is not because they are locked down. In fact, in Israel, everything is completely opened up, and their numbers per day continue to go down. And that really is a function of the vaccine. And so this is great evidence that the Pfizer vaccine is incredibly effective, and they also have variants and seem to be effective against the variant. And with that, I'm going to stop. Let us all remain calm. This is maybe the tip of the iceberg, but we'll see. And I will mute myself.
I will unmute myself. Thank you so much, Dr. Rubin. And we'll be lucky enough to hear more from you as you're staying on to join our medical panel. So thank you so much. For those of you watching, Michael Cohen and I will ask the panelists questions for the next 20 minutes or so. And after that, it's your turn to ask questions in the Q&A feature in the session info on the right side of your screen. So I will read the questions to our panelists. So I'd like to start introducing our other panelists. So first of all, Dr. Debbie Schwartz is an emergency room doctor at the Lachine Hospital of the McGill University Health Center and a family doctor at Centre Médical Santé Montréal. You may recognize her name as she's been a regular media commentator on COVID-19, and her children attend Merton Elementary School in Côte-Saint-Luc.
Thank you, Caroline. And by the way, fascinating presentation, Dr. Rubin. Thank you so much. You had me on the edge of my seat throughout the presentation. It was very, very informative. Aaron Derfel is the medical reporter at the Montreal Gazette, specializing in investigative and narrative journalism in a 30-year career that is taking him across North America. He's a three-time team finalist of the National Newspaper Awards, and in 2018, he earned a National Newspaper Award Citation of Merit in the investigations category for a four-part series exposing how budget cuts led to an increase in hospital violence at the Montreal General. If you read the Gazette yesterday, he's been nominated for more awards for his coverage of COVID. He's reported extensively on the COVID-19 pandemic and produced a daily Twitter a thread that's a must read by actually thousands of Canadians are going to it. He also finds a way to teach journalism part-time at Concordia, and he has two children at the EMSB, one at Royal Vale and the other at Willingdon. So I think we'll start off, Aaron, with the first question to you. You've been covering COVID-19 for the Gazette since the pandemic began. What have been the most surprising aspects about the response to the epidemic to you as a reporter and as a parent?
That's an excellent question, Mike. Also, I want to convey just how much I appreciated Dr. Rubin's presentation. It was just so up to date, thorough, and actually very newsworthy too. So I very much appreciated it. To answer your question, Mike, I think we've seen around the world how governments have responded. New Zealand has been widely praised. In the United States, certainly under the Trump administration, the U.S. response was criticized. I think in Canada we've had varying responses, and I think what struck me is often I find that our politicians are not proactive enough. They wait to see the wave go up, and then they react belatedly. So that's something that that surprised me, and that at times has troubled me.
Okay, thank you. And I guess I have the same question to Dr. Schwartz. What has surprised you as a physician and a parent over the last, let's say 13 months?
Hi, everyone. First of all, Dr. Rubin, I do want to thank you also. It was so informative. And one of the things that I find that you're so good at is giving a presentation that is applicable to the public, and so that the public can really understand. And I think that that has been my priority over the past 13 months, has really been trying my best to convey whatever information I have to the public in a way that is easy to understand. Because I think that so much of, there's so much information and there's so much misinformation, and hearing everything in such a clear, concise way is really, really helpful. So thank you for that. So you asked what has surprised me as a physician. I guess I mean, there's a couple of things that I can say, over the past year. I think that it's been really challenging to see the school system be kind of played with. I think what challenged me the most as a physician is how long it took to implement the proper social distancing within schools and the masking within schools. I think that it was really clear from the get-go that that was what was needed. And I don't understand why the Quebec government took so long to implement that. I do think it's been helpful. I think kids are incredibly resilient, which is another thing that I'd say, never fails to surprise me. I see it in my children. I see it in my children's friends. They have adapted to masking surprisingly well. They tolerate it. And that's been really nice to see. And of course, there is a lot of, negative, as Dr. Rubin pointed out, about there's an increase in domestic violence, in child abuse, and suicide rates, in behavioral issues amongst children. But overall, I would say their resilience has really impressed me as a parent as well.
So Aaron, let me, Dr. Schwartz alluded to it, and she talked about schools and the transition to masking and the social distancing and all that. Let me ask you, do you think the government made the right decision to keep the schools open?
I think on the question of schools, I think that the government has acted often, I believe, imprudently. And I think that this is an unintended consequence of the pandemic. Certainly, the constitutional guarantees afforded English school boards have turned out to be a blessing in the pandemic, because the EMSB and Lester B. Pearson, they have gone out and purchased air purifiers. And the Legault government has really downplayed the aerosol nature of this virus, and the need to improve school ventilation. The government has been heavily criticized for perhaps doctoring the test results of CO2 levels in classrooms. This is a big issue. And I know that on the Francophone side, there's a lot of anger among parents toward the Legault government over this. And so I think that the fact that the English language school boards have that autonomy has enabled them to act much more prudently and proactively. And I think that that's been one of the unintended positive consequences. I don't know if that will strengthen the EMSB's hand as it seeks to continue to be protected, I guess, under the Constitution. This is a different matter. But to get back to the issue of schools, I do think that time and again, Legault has said he wants schools and children. He wants children in schools, and that's understandable. But I've been talking to a number of experts, doctors, infectious diseases experts, who have children in school, and who do feel that even right now in Montreal, we should switch to distance learning, because we've been stuck in a plateau of 350 to nearly 400 cases a day for about 5 or 6 weeks, despite the increasing vaccination. The variants are proliferating. And someone like that, Dr. Matthew Otten, he's told me that let us drive down community transmission first, and as we ramp up vaccinations, and then we'll be able to reopen schools. So I just think that this is another example of what I was alluding to before, that that the government has often reacted belatedly and always reacted, not necessarily been proactive. I will say that we're at an odd point in this pandemic where we're observing a huge increase in cases and hospitalizations and ICU stays in Ontario. We're not necessarily seeing this in Quebec to the same extent. We seem to be more in what I would call a slow burn, but we can't take anything for granted. But I do find that of late, Legault has listened a little bit more to the public, but it's still, I think, a reflection of the fact that he comes from a business background, and we've seen this in other jurisdictions when you have these populist leaders who come from the business community. The thinking is, let's reopen. We can't afford to keep the economy locked down. We have to let's reopen, and perhaps they reopen too early. And that leads to this yo-yo effect. Whereas in other countries that have adopted this zero COVID approach, like New Zealand, they have been able to handle the pandemic much better. Sorry about the roundabout way of answering, but in general, I don't think that I would give the government maybe a C- in its handling of the pandemic when it comes to the schools.
Thanks, Aaron. And Dr. Rubin, I'd like to hear your sort of view on that quickly. Do you think, are you in line with Dr. Alton, who believes that maybe we should be going to online learning? One of my children actually is in one of the closed classes as of Friday noon.
So, on one hand, I agree. So Matthew was also one of my residents at one point, just like Debbie. On what he's saying makes a lot of sense but everything is a risk-benefit balance. So if you really want to get these numbers down, the most effective way is for everybody to lock themselves in their room by themselves. It takes 2 weeks to see an effect because that is your incubation period. And the only time they're allowed out of their room is to get a vaccine. And then you open up after 1 to 2 incubation periods. And you will see that the numbers will be as close to zero as you can possibly get. And then if we look back to June 2020, the number of cases in Montreal were under 50 per day as we were coming to July. And that was because schools were closed, government, non-essential businesses were closed. It was all prior to things opening up. So you do have the history to say that will do just what we wanted to do. But it's a risk-benefit balance. And whether Legault is a businessman, yes or no, he still is the head of the government for those who represent kids, parents, businesses, and he needs to find that balance for the economy and for the people who are suffering and dying because their businesses are closed, they're never going to reopen. It's not a clear-cut answer. And if we are looking at our metrics of the number of hospitalizations, the number of ICU, and the number of deaths, in spite of schools being open, we're not seeing that in kids. The question is bringing it home to their parents. And so really the answer here is to be as effective as possible in rolling out the vaccine. It is very unfortunate, the vaccine hesitancy that is increasing because of what's being reported with AstraZeneca, that is going to kind of get in the way of where we really need to go. So that's my position. And if we have time later, I can come back to my answers to the questions that were asked before about what the government did right and wrong.
I don't know if we're going to have time.
Questions.
We'll see. I did just want to get you on vaccination, though. You talked about the Pfizer and Moderna vaccines being in clinical trials for 12 to 15-year-olds. So I have 2 questions. When do you think that they will be approved for these ages? And are there clinical trials looking at their efficacy in younger children?
Yeah, so From what I hear through my friends in high places, that Public Health Health Canada will likely have the emergency release for children 12 to 15 come the end of May, early June. Based on the data they have, it's been submitted. So that for Pfizer. For Moderna, they're a little bit farther behind in terms of the licensing. So that's your first step, is that it has to be approved and licensed. Then your next step is having an adequate supply to be able to roll it out. And so that is another competing factor. Just because it is safe and effective in the 12 to 15-year-olds come the end of May or early June, it may be that we still have not vaccinated that 30 to 60-year-olds who are getting admitted. And that certainly will take priority. The expectation is by September, they are hoping that there will be enough supply for those over the age of 12 to be vaccinated. There are currently studies looking at the 5 to 11-year-olds and not yet the 6 month to 2 years and 2 to 5 that are starting, but that's going to be further behind. So I don't know if that answers your question, but hopeful maybe for those children with underlying illness or who are at higher risk come the beginning of June, we may be able to roll it out.
Just a quick follow-up, Dr. Rubin. I guess realistically, we're looking at next school year being pretty close to what we're dealing with now. Certainly the beginning of the year, everyone wearing masks. We haven't been able to have school assemblies or school events. I mean, do you believe that we're going to be in this mode because of the kids not being vaccinated for another entire school year?
I really hope not. I think it's going to take time before you can have your school assemblies and going back to normal. Ideally, it will be with 2 doses of your vaccine under your belt, and that will take time, and that will not be immediate. If I would, as a wishful thinker, it would be nice that a majority of kids will have received 1 dose before the beginning of next school year. And that may help, but I don't think that we are losing masks and we are losing distancing as a mitigating measure in the near future. I think we really have to be vigilant and maintain that. That really has proven to be of the greatest benefit. There is, however, good data out of Massachusetts prior to the variants that they looked at 55,000 kids. Schools, half were distanced at 2 meters and half were distanced at 1 meter. And they found that there was no difference between the two, but that was before the variants, which led the CDC to say that 1 meter distancing may be sufficient. And maybe that will kind of come to fruition. And so there may be some lightening. All of that to say, there may be some lightening come the next school year in terms of the distancing. And we'll have to see how the vaccine campaign rolls out.
Great. Dr. Schwartz, I want to ask you, about the variants. Dr. Rubin talked about the variants and their efficacy or not against the vaccines that we have currently. What do we know about the efficacy of the various variants or the various vaccines against the, 3 major variants, and then the 2 others I don't think we know much about at all, but.
Yeah, well, I believe, Dr. Rubin can probably attest to this, but I believe that the vaccine is looking like it is effective against the variant that we're exposed to the most here, which is, I believe, the B117.
Yeah, it looks very effective against the UK variant. Data out of South Africa, at least with the AstraZeneca, may not be as effective against the South African variant. But thankfully right now, and that's just now, and like I said, things will change in the future, the overwhelming majority of variants that we are seeing is the UK variant and seems to be covered by the vaccine. So it really is a race in time. If we can get more people vaccinated while that is there, then it will be really effective. As you have more people who are non-immune, it gives the virus a greater chance to modify it. And the introduction of the variant
Yeah.
So it really
I
is
think
a race against time.
I think that the priority really is to encourage people to get vaccinated and to really dispel all of this, all of the myths and the misinformation surrounding the vaccines. And it's so unfortunate to see the role that the media has played in making the vaccines appear devilish in form, and I think that that should be our priority, and that's what I see my priority as. And I use every opportunity with my patients in the family medicine clinic to encourage vaccination, because, like Dr. Rubin says, I really think that's what's going to get us out of this hole. So I think that that should really be the priority now. We should be putting all of our energy into vaccination.
So you're in a target group for that AstraZeneca thrombosis. Let's say you're a woman, and we saw from Dr. Rubin's presentation that the thrombosis, the clotting, affects women more than it does men. So for all the women that are listening, would you get vaccinated with AstraZeneca?
I would. Yes, I absolutely would. I wrote an article about the AstraZeneca specifically, and I was a big proponent of it. And my husband, although he's obviously male, but he was in the pilot project group in Côte St. Luc, because one of my children is not at Merton. And as most of you probably know, I was very vocal about the fact that Merton was excluded from the pilot project, but we have a younger son in a daycare that was included. So he was eligible to be vaccinated, and he is a teacher as well. And I told him, absolutely, if whatever they offer you, you grab that, because that's what's going to get us out of this. And so, yeah, absolutely, I would have gotten it personally myself. I think that it's a risk benefit ratio, and I think that the risk is really high of COVID, of ending up in the ICU, and I think that the benefit far exceeds the risk.
I guess it's a perfect segue to Aaron. Aaron, I mean, you're one journalist. You're the most prominent reporter on health in Montreal. What do you believe that the role journalists have played regarding the vaccine hesitancy and AstraZeneca, and whether there's any role that you can play, journalist, to get more people out there to get vaccinated and feel safe?
Yeah, so I think that picking up on what Dr. Schwartz said, and I think what Dr. Rubin said, the news media has a lot to answer for in terms of obsessing over the minutia of the AstraZeneca vaccine. I mean, certainly the fact that authorities said that for now they're suspending the use of the vaccine in people under the age of 55 across the country and here in Quebec, that has given rise to some doubts. But certainly the media have played a role in fanning the flames of doubt over the vaccines. We have a lot to answer for that. As far as myself, my mandate, that I've given myself during this pandemic is to focus on the government response and where the pandemic is moving. And so when it comes to issues like potential treatments or vaccines, I really haven't dealt that much on that. And when I have focused on vaccines, it's been more what's the vaccine coverage? And as Dr. Rubin pointed out, I wrote a thread about the Israeli response and how, we're in this paradoxical situation right now where we're ramping up vaccines and cases have been going up. Well, that's exactly what happened in Israel initially in its last wave. So it should be reassuring that as we vaccinate more and more of the population, eventually we'll be able to flatten the wave. But in terms of my personal conduct, I'm 54. So I don't. If I were 55 or 56, I take the AstraZeneca vaccine. In fact, my brother, who is 56, he had asked me, should he get the AstraZeneca, and I told him yes. I said you have greater risk of developing a blood clot as a result of COVID-19 than with the vaccine. So he did get the vaccine recently. But just to recap, I guess I could write a little bit more, but it just takes so much of my energy to focus every day on where the pandemic is moving in Montreal and Quebec that I really have steered clear of more of the medical issues and the scientific issues, and dealt more with the management side of the equation.
I think I'm going to speak to Legault a little bit later and ask him if he can make a special circumstance for Aaron at the age of 54 to get AstraZeneca. The whole thing, Aaron.
Well, as a matter of fact, I think you are eligible because you just have to have been born in that particular year. So I think if you do present to a vaccine clinic, a vaccine site, I do actually believe that you would be accepted, especially when you show your name.
Yeah. Earl's going to pick you up this afternoon and drive you to Pillsbury Marina. Okay? Caroline, the final question before we go to Q&A.
Yeah. So Dr. Rubin, you had COVID. Can you talk about, I mean, were you a little, well, you're a physician, and so you're on the front lines and you're exposed to patients and the risk is higher for you. Were you surprised to have gotten it? And can you talk to us just quickly about your COVID case and what you went through?
Sure. So I have to say I was very surprised I got it. It's the irony of everything. I'm an infectious disease specialist and one of 2 infection control people for the children's, where we put in all the policies to prevent healthcare workers from getting infected. And to make the irony even worse, the person that I expect I got it from is from the other infection control lead. I had not seen a patient in 2 weeks before I got it. My wife does all the shopping, and she does that really well, if you're listening, and prepares and looks after the family, and I do nothing for that. I actually had even no gas in my car, and the only contact I had was with my colleague doing a sign over on December 28th, 6 feet apart, both wearing masks, but for greater than 15 minutes. And she got sick that night, had a very high viral load. It was predating variant testing, so I suspect it would have been a variant based on how easily infectious it was. And I tested negative on day 5. I was asymptomatic and felt very comfortable, planning to retest on day 10. On day 7, I started to develop some fever. I said, I'm right in that sweet spot. I'm sure I have it. I retested again and I was negative. Did everything that we tell people to do. If you really believe you have COVID, you have to retest 48 hours later and isolate yourself as you wait. And true enough, 48 hours later, I was positive, but with a very low viral load. So I thought, okay, I'm not going to get that sick. And unfortunately, 9 days later, I was admitted to hospital. Thankfully, never made it to the ICU, but did get steroids and remdesivir. And I'm very grateful to be where I'm at. I'm not exactly where I was before. I was never perfect. Certainly now a little less than perfect, but very grateful and hoping that with time things will resolve completely.
Thank you very much, Dr. Rubin. And I hope you do continue doing better. You don't have long COVID. Anyways. So we'll go to the public Q&A. I know that we have a lot of questions coming in. So excuse me, I'm looking at this on another screen, which is why I'm going to be looking to the right here. So the first question are there known risk factors? Whoops, and it just changed, so I can no longer see that again. Thanks, Daniel. So this is a personal question, but I think I'll try to contextualize it a little bit more. His wife has diabetes type 2, and she's being followed by a doctor. They've asked to get her vaccinated. She's only 50. The doctor says she needs to wait. So a lot of people are wondering, people with certain health conditions, they'd like to have their vaccination sort of timeline sped up. So is that possible?
I don't know, Deb, do you want to answer that? Or
Yeah, so unfortunately now the patients that are with chronic illnesses that are being prioritized for vaccinations are those that are hospitalized or are followed in hospital clinics. So unfortunately, the general population that has chronic illness that's followed in the community, it's very difficult to get these patients vaccinated still. I have a lot of people that are calling me, asking me. I'm doing my best. I mean, I'm writing letters But unfortunately, this is not something that, I think that community physicians have control over. And right now, the only patients being vaccinated are those in the hospital settings.
All right, thank you.
It really is a numbers game. The expectation is that Canada will receive 8 million Pfizer doses in the month of May and an additional 12 million in the month of June. That's for the country. It then gets subdivided, and it really comes down to the numbers game. And they are a priority group to get vaccinated, but the numbers are not there yet to be able to rule it out completely.
So the next question, thank you for all your great insights. My question is, I guess this is actually more towards Aaron, quite frankly. What changes do you think need to happen first to our education and health systems post-COVID?
Okay, so certainly in terms of the health system, and this is something I'll give credit to Legault for. So he has hired about 7,000 préposés aux bénéficiaires, patient attendants to work in long-term care. A lot more has to be done. Long-term care is often treated as the poor cousin in the healthcare system, and something has to be done. It's been a national shame that there have been so many deaths in long-term care in Quebec, which is it's just been so shocking, and also in Ontario. And our healthcare system before the pandemic was very, very fragile. So I was actually a speaker in a conference a few days ago on the cancer situation. There's a real crisis in terms of cancer care in Quebec, and this has been observed in other jurisdictions, but our system was so vulnerable. So you're going to see the fallout in terms of higher mortality rates for cancer, because there are people who are presenting, will be presenting with a more advanced disease. And I don't know how we'll figure that out, but at least in terms of elder care, we've hired more patient attendants, and I think that's a good thing. Now, in terms of the school system, this is again, I'm returning to, I think the English Montreal School Board and Lester B. Pearson that really have been very forward thinking. And I spoke to Joe Otona about this, that I think that, it's good to have cleaner air in the classroom. And there have been studies by the Environmental Protection Agency in the U.S. that show that the condition of a building, there's a link between the condition of a building and student performance, academic performance. And the worse off a building is in terms of the air quality, the worse the academic performance will be. So I think that Roberge is on the hot seat, and he's really being grilled by the opposition parties and a lot of francophones in Quebec on this issue of improving ventilation. This is something that had to be done before. There are a lot of older schools, so I think that's certainly. I think I'm hoping at least the Legault government will be more accountable, but I'm also relieved as a parent and as an observer to know that at least on the English language side, and because of that we have greater autonomy, we've been able to move more in the direction of making our classrooms healthier.
Thanks, Aaron, and apologies for the dog barking near me. Anyways, the joys of being at home. So I'm going to just ask you all to just try to keep your answers short, because we've got 10 minutes left and about 50 questions. So we won't be able to get through all the questions, but I'm going to go quickly. So can one of you talk about herd immunity and how it relates to mass vaccinations?
So the concept of herd immunity is that if the people around you are immune, they can't get infected and they can't transmit. And the number to reach herd immunity is 75 to 80% of the people being immune. So in terms of mass vaccination, that is of the total population. And it's right now, I don't know off the top of my head what percentage of Canada's population are in kids under the age of 12. But I do not believe it is greater than 25%. I'm certain it is less. And so if we're effective in getting everybody vaccinated over the age of 12, we will be at that point of reaching herd immunity.
Dr. Schwartz, in Israel, they haven't vaccinated people who had COVID. They test for antibodies first. And this person is wondering if it's the same approach here, and is it beneficial to take on this approach?
So we're not testing for COVID antibodies in the like in the general population. So right now we're vaccinating everybody. And if you've had COVID, you get your dose 3 months after you're eligible to get your dose three months after you've had COVID.
I don't believe in Israel they've taken that approach. The antibody testing is not a very valid, reliable test. Like Debbie said, in terms of 1 dose at 3 months, and that's based on the concept that you are immune for at least 3 months post having disease when you recover, perhaps up to 6 months. And the 1 dose of the vaccine is kind of acting as your second dose. And in Quebec right now, it is approved only for 1 dose if you are COVID recovered because of that concept.
All right. The next question is, do we think CEGEPs will be open for in-class learning in September?
So,
who has the crystal ball?
So I think that it really, CEGEP students are 17 and older. I think it will really very much depend on where we are in the vaccination status. If they're going to open up fully or have a hybrid model, we'll see.
The next question is about the dosing intervals. So a lot of talk about that in Canada. In Quebec, it's 4 months. So is that a potential issue to wait 4 months for your second dose of a vaccine?
So if you don't mind, I'll answer that. And so a lot of the anxiety came based on the pre-marketing studies, where for the Pfizer vaccine, it was on day 0 and day 21, for Moderna day 0 and day 28. And that showed the 95% efficacy. So people very much want that. They did not, in their pre-marketing studies, look at what is the effectiveness or protectiveness at 1 month, 2 months, 3 months, 4 months, etc. It was really a very rapid rollout. So we didn't have that information. But certainly now amongst healthcare workers who got, most of the people, at least here at the MUHC, got their vaccine early January to mid-January, we've seen very little in terms of breakthrough cases. And they're now eligible for, Quebec is set to go to 16 weeks, but at least at 12 to 15 weeks, we see that it is still effective. So right now, I don't think it's having any negative impact.
So we have a number of questions about traveling. So we can talk a bit about vaccine passports, or some people are asking, can I travel after the first dose? When will the borders be reopened or whatnot? So, vaccine passports are an option that countries are looking at. When do you foresee people being able to travel either within Canada or to the United States elsewhere?
So I really think it will be based on the epidemiology of where they're coming and where they're going. And what is going to impact that epidemiology, meaning the number of cases in the community, will be very much linked to the vaccine and what variants are circulating. And so having a passport, right now you can't even travel between Quebec and Ontario as of tonight because of the epidemiology of what's going on in Ontario. So it's a very difficult question to answer. It will be very specific to what's going on. As negative as I am about what goes on in the States, what has happened and what is going on, right now, the attack rate of COVID in the States is lower than what we have in Canada, and that's a function of the vaccine. So they're nowhere near what we see in Israel, but they are inching much closer to that protectiveness where we may be able to travel. So we'll see. Time will tell.
I have a few more questions about the AstraZeneca vaccine and the Johnson & Johnson vaccine related to the blood clots. So people are asking if someone under 55 who has a history of blood clots or DVT, should they still take these vaccines? I had heard personally that it affected mostly people with low platelets to begin with. So are there conditions in which people should not take that vaccine and not take the risk? I know Dr. Schwartz, you had said, yes, take the risk. It's better to be vaccinated than not. But for certain people, should they be watching out for that?
Debbie,
I think it's a difficult question to answer because everything is so new. You know, everything with this pandemic is so new, and I think that we just don't know. Personally, for me, what I've counseled my own patients with specific these kinds of risk factors, for now, I've counseled to wait. But I don't think that there's a hard answer. There's no textbook answer for a lot of these questions. I don't know if Dr. Rubin has a different approach, but
so certainly there is something called HIT, or heparin-induced thrombocytopenia, that if people have had a problem with heparin, the pathogenesis of this is very similar, and that is a hard no. In terms of increased incidence of blood clotting, I agree with Debbie. I'd be cautious at this point in time, but there isn't very clear answers, but I would be cautious if there really is a personal history in the past of clots or thrombocytopenia, which is low platelets.
I've got another question that was geared towards Dr. Rubin, but I don't know if Aaron, you also want to answer. The question was why schools are not fueling the fire, coming from your presentation. Is it because of the precautions and may be more attention to following the safety rules, or is it because of the biology of the virus that makes milder infections in children?
I think everything is multifactorial, and it's not necessarily, when I showed you the graph of the outbreaks and the number of kids within the class, I really believe that the majority of kids who are positive, who are school-age kids, are getting it in the community and not adhering to public health policy. Majority, I don't know if it's majority, but it is certainly contributing. And so you cannot just tweeze out and differentiate that this is all because of schools. There are kids who are going to school, who are living their lives on weekends and after school. If we can optimize the mitigating factors of trying to prevent transmission, that certainly is still the way to go. But I don't know, Aaron, if you want to pick up from there.
Yeah, so Dr. Mylène Drouin, who's the head of the public health department for the longest time, was of the position that children were getting the virus in the community, and that schools were not a factor. But during the variant-driven third wave, she changed her position. She modified it somewhat, and so certainly in the communities of some communities in Côte Saint-Luc and Snowdon and Côte-des-Neiges, where there were outbreaks in schools, the guidance was, and that was justification for the pilot project, is that school children were carrying the virus, going back home, giving it to their parents, and that's why they should vaccinate the parents. So she modified her position. Speaking to Dr. Carl Weiss, who is an preeminent infectious diseases expert, he was of the position that it was the schools in the second wave that caused the second wave. So there's been some debate about that. What I will add is that Premier Legault, when he's been asked about this, in my opinion, he's misdirected. He said, look, children are not at risk of developing severe complications, and it's better that they go to school to study. That's been his position, but that's not the issue. The issue is, will children, whether they've got it in the community and they go to school and they give it to somebody else, and the result is an outbreak that then rebounds out back into the community and accelerates, and parents get sick. Certainly that's happened in the third wave. So I don't think he's been completely frank with the public in talking about the role that schools play in the amplification of the spread of the virus. And certainly Dr. Drouin's opinion, at least, it's changed during the third wave.
Aaron, thank you very much for that. I want to thank this panel. I want to thank Caroline. It's great to have a former journalist who could co-chair this with me today. You did a great job. I could have listened to the three of you all day long. I think, frankly, we might want to do a follow-up seminar just on COVID because it's not going away, and maybe we can get you guys again at some point in the future. Dr. Rubin, Dr. Schwartz, Aaron, thank you so much for your time. Really appreciate everything you said, and it was really, really beneficial. And I'll turn it over to Daniel Tatone.
Thank you, Michael. This was absolutely excellent. I really appreciate it. I really appreciate the facts. I appreciate the numbers. I appreciate all the input from all the panelists. Thank you so much. The actual session number 2 is already starting, so I'm gonna ask people to go ahead and you can start that. I just want to remind everybody there's an info, if you're looking for any information, the agenda is in the info and in the welcome message. And there is, and you can have a little orientation on how to do certain things in the conference, such as the breakout rooms for parents and the exhibition hall. So have fun today. Thank you to our panelists. Thank you to Michael and Carolyn for moderating. This has been excellent. Have a nice day. Have a good, great conference.